Great, thank you very much. This presentation is going to highlight some of the concrete social protection programming opportunities and challenges. So to take forward some of the insights into the vulnerability profile that we heard from the first speaker, and then to put some flesh on the National Social Protection Framework issues that Rebecca just discussed. So the presentation is going to be organized as follows. Firstly, I'm going to talk about some of the social protection initiatives to tackle particular human capital deficits that children face in the region. Then secondly, to look in more depth at some of the initiatives to tackle child and maternal health vulnerabilities, followed by a particular focus on children's vulnerability to violence, abuse, and neglect. And finally, to think through some of the possible opportunities for synergies with existing informal social protection mechanisms. So if we begin with the first issue, which has probably received the most attention, it's been most discussed in the region, as we've previously learned in previous presentations. And it's also an issue that's been discussed a lot internationally, and that's that around social transfers. So here there's been a real focus on the issue of addressing vulnerability that children face in accessing basic services, so trying to address particularly the cost barriers that many children face in either receiving a basic primary education or basic nutritional or health programs. And there are many reasons to be optimistic in the region. First of all, there are pilots or small-scale programs already underway in a number of countries that have been mentioned: Nigeria, Ghana, Cape Verde, Sierra Leone, Burkina Faso. And what we also see is that there's an extensive amount of lesson learning from other regions. So there's already been exchanges between officials, for example, in Nigeria and Ghana, with the much better established programs in Latin America. So particularly learning from the very successful programs in Mexico and then Brazil's Bolsa Familia program. And as we've already discussed, the Ghana program in particular, the LEAP program, is the largest in scale to date. So within less than a year, it's already reaching 26,000 households and about 40% of the districts nationwide. This program is particularly targeting OVCs, orphans and vulnerable children, but also the severely disabled and the elderly, particularly the elderly who are caregivers for children who might have been orphaned. There's a monthly transfer of between $8 and $13 US for this program. And it depends on the number of dependents in the family, up to about 4 children. And critically, it's trying to introduce some key elements around children's vulnerability to protection from violence, abuse, and neglect. So at least in theory, it's conditional on birth registration. And children who lack birth registration then often, in turn, are barred from accessing education and health services. So it's a critical precondition for tackling key child vulnerabilities. And there's also attention that any beneficiaries can, have to commit to not involving their children in either child labor or child trafficking. The other key dimension is that there's been a development modeled on the Brazilian system of a single registry system. So what this does is help to coordinate possible linkages to existing complementary services that children might get access to. So rather than just having a database for the children who are accessing the cash transfer, there's also a possibility to then coordinate what other types of services they're able to access. And finally, there has been considerable involvement of community leaders in Ghana in this process, so to help identify the most vulnerable children and also to monitor the rollout process. However, by the same token, as Rebecca has emphasized, there are some really important challenges that we need to think about and to move cautiously when advocating for scaling up of cash transfers in the region. I think we do see some government commitment, but it's still limited, and this is clearly reflected in the scale of the programs. So even after 5 years in Ghana, the LEAP program is only going to reach 1/6 of the extreme poor. So only 3% in the extreme poor. There's about 18% of the population. So it's still a very tiny percentage of children who actually be covered. And then in the case of Bursmamong and Mali, that's only reaching several thousand children, so it's very tiny. I think another key issue that is emerging and that some other colleagues in ODI are looking at is the real concern about how do we ensure that the most vulnerable are effectively targeted, in thinking through the development of context-appropriate targeting tools. So on the one hand, the more sophisticated targeting systems that we see in Latin America, they're very data-intensive and they require considerable capacities. But on the other hand, the sort of categorical targeting approaches that we see in Ghana, so just focusing on children who are orphans, for instance, is actually likely to miss out on many of the poorest and most vulnerable children, because orphanhood and poverty are not necessarily correlated, or at least extreme poverty. And then we also have a real issue of politics to grapple with. I think one of the really striking things is if you look at a poverty map in Ghana, the intense sort of poverty and vulnerability is clustered very much in the northern regions, but that has not really been addressed through the LEAP cash transfer program, and it's only been very recently with additional World Bank funding and prompting that the northern districts have been included, and also on a relatively short-term basis. So there are some real challenges there. I think the next key issue to think through is monitoring and evaluation. Obviously, this is critical to see in countries with such resource-constrained economies whether or not these types of programs are making a difference. But it has been relatively neglected, unfortunately. Even in Ghana, the program has been in place now for about 15 or 16 months, and a baseline has still not been established. There are plans to put that in place, but this is quite a delay, even though it was part of the initial design. And this is something we've really got to put more energy and resources into, I think. One of the other issues that's already been mentioned quite a bit is the importance of having a cross-sectoral approach, given the multidimensionality of children, so making sure that a range of ministries are involved, not just often the weakest ministries focusing on children's social welfare, but involving agriculture and labor, health, education, justice, etc. That's really critical. And then finally, we need to think through issues about program sustainability. In Ghana, for instance, for the children receiving the benefits, there's a 3-year program graduation condition, but there's no real thought yet as to what will constitute graduation and how this transfer of just $8 to $12 a month is really going to achieve this so that families can leap out of poverty, so to speak. Moving on now to the issue of addressing child and maternal health vulnerabilities. Again, I think we do see many reasons to be optimistic in the region. It is worth highlighting again that the region is most off track in terms of meeting both MDG 4 on child mortality and MDG 5 on maternal mortality. But at the same time, I think there is growing international momentum at the moment, which we could capitalize on. So there's a growing agreement about the need to eliminate user fees for health services, and I think Rob will be able to talk more to this later. Secondly, there's now a new campaign that Save the Children is leading, focusing on child survival issues. And then we also have a global maternal mortality campaign. It's still small, but I think there are opportunities there. And as we've already heard, another interesting model to think about is the National Health Insurance Scheme in Ghana, as a possible model to increase social health protection for children. It has important exemptions for the very poor and also exemptions on maternal health services now. But again, we also face some critical challenges. Yes, we do have a growing commitment to remove user fees, but we do then need to see that match with strong government commitment. I think only in Ghana was it possible to introduce the national health system because it was one of the flagship programs of the previous government, and it was one of the key issues that the president pushed. So it does need that very high-level support. And I think in the short term, in terms of financing for these very poor countries, obviously donor support to make the transition possible. Secondly, and sort of building on some of the issues Rebecca raised about governance and capacity constraints, there's a rich body of evidence now on good practice from transitioning away from user fees, but it does require very careful planning and management, especially in terms of coping with short-term losses to local providers and some of the medication issues that arise. And I think, again, in terms of affordability concerns, which are always raised when this issue comes up on the table, they've obviously been magnified now by the current global economic crisis. So it's something we need to consider, particularly in the follow-up to the G20's announcement of the Vulnerability Fund. And lastly, I think we do need to also have a debate about the political and fiscal feasibility of removing user fees without this high level of support, and perhaps think through what social health insurance can offer. But at the same time, it is more aggressive. The lower wealth quintiles do not have the same access, and exemptions are also needed to ensure access to basic maternal and child health services if it's going to help towards achieving these MDGs. Moving on now to a really critical area that we've looked at in our reports, children's vulnerability to violence, abuse, and neglect. Again, I think there is a growing recognition about the duality of children's experience of vulnerabilities involving not just economic but also social risks. And this was really spotlighted internationally by the 2006 UN study on violence, which highlighted the need for urgency in tackling violence against children in multiple settings, so in the house, in schools, in communities, in the workplace, and also in conflict situations. And then also on the positive side, we do see, partly because of the prompting of the Committee on the Rights of the Child in Geneva, the monitoring body for the United Nations Convention on the Rights of the Child, increasing passage of social equity measures in the region. So we do see a range of laws against child trafficking, against harmful forms of child labor, against gender discrimination. So there are some changes. But I think here, perhaps more than any of the other areas, we also see enormous challenges. The concerns about aligning national legislation with international child rights commitments. This is really difficult. We have all of the countries in the region have signed up to the United Nations Convention on the Rights of the Child, but it hasn't been harmonized with their own domestic laws, which is what really counts for children's realities. The legislation is poorly implemented and resourced, and very often social welfare agencies are completely absent at the subnational level. So they're present in the capital, but there's no corresponding body at the subnational level to carry that through. And then finally, most social protection debates are still paying limited attention to protection-related vulnerabilities. But I think this is a real concern because children who are vulnerable to violence and abuse may in turn not have access to other basic social services. So children who face violence in schools, we've done some previous research with Plan on this and have shown that the close links between school dropouts and children who are exposed to violence within the school environment, just as one example. So we really urgently need to tackle these protection vulnerabilities so that the other programs in place, such as cash or in-kind transfers, can be really of maximum effectiveness. And finally, just some thoughts on complementarities between formal and informal social protection systems that have come out of our reports. I think what's key to highlight is that social protection really is not a new concept in West and Central Africa. These informal mechanisms are based on traditional principles of reciprocity and mutual exchange, and they've long existed. And there's some very interesting research coming out of Ghana, for instance, highlighting the range of different types of informal mechanisms that we find. So obviously, kin-based support systems are very important, and remittances. There's an estimation of 5 billion US dollars in the region, in Ghana in 2005. So it's obviously a very critical part of the national economy, but is also under threat at present with the global economic downturn. Trade associations are another key source of support, so people working the same types of economic areas providing support to one another. Obviously, faith-based networks, either mosques or church in the region are critically important. Credit societies, and also a child-specific system, which is child fostering. So children who have become orphaned were traditionally taken into the extended family system. This is still continuing, but to a lesser degree in some regions, particularly those very hard hit by the HIV epidemic, for instance. And a really critical dimension of these informal systems is that they differ from formal systems, that they're not only not time-bound, so there are no pressures in terms of graduating, for instance, within a certain time period, and they're also very flexible, which is not always the case with some of the more formal mechanisms. But clearly we have a range of challenges to face. So with growing urbanization and modernization, and also within this process, the declining importance of the extended family, we are seeing an erosion of informal mechanisms in the country. And this is why there's now realization that we need to think about formal mechanisms as well. And as I mentioned before, again, this is becoming particularly pressing with the economic downturn and other types of macro-level shocks that the region has been very susceptible to, including environmental shocks. But finally, we still know very little about how the formal systems that are being introduced are impacting on informal mechanisms. It hasn't been extensively studied, but obviously this is going to be important to investigate so as to promote complementarities and not to undermine existing structures. So just by way of conclusion, I'd like to end with these 4 key points that sort of summarize what we see child-sensitive social protection comprising of. So firstly, it's an attention to the multidimensionality of children's vulnerability to both economic and social risks. Secondly, it includes attention to both general and child-specific forms of social protection programming. Thirdly, it's absolutely essential to tackle the MDGs, particularly the health-related ones around MDG 4 and 5, and also meeting UNCRC commitments. Again, very important, this being the 20th anniversary of the UNCRC. And finally, there's still much to be learned through greater South-South learning, both within regions and across regions, particularly in terms of these issues around integrating formal and informal mechanisms. Thank you.
Thank you, Nicola. That very detailed and interesting presentation. We're going to move straight on to the 2 discussants, not more than 10 minutes each, and then we'll open up the floor for everyone to participate in the discussion. I'm sorry about the noise in the background. We've decided to work on the road again, which has been going on for some time, but hopefully